Alright, we want to just do a very short video on vertigo. Vertigo is a very common chronic health problem that exists not only in the United States, all over the world. And unfortunately, medically speaking, there's not much they can do. In our office, we probably see 10 vestibular type chronic health cases a month, and that can be from vertigo to Meniere's disease to vestibular migraines. But what I want to get through to you, most of these cases end up at HEENT, some of them end up at house clinic, and they run them through a whole battery of tests, and by and large I'd say 95% of them leave with a diagnosis of Meniere's disease or vertigo. But at the end of the day, there's not much medically they can do. Yes, they may give you antivert, which may help your symptomology, and if you have severe Meniere's, they may do a shunt surgery and some of the other things. But at the end of the day, if you talk to most of the people with these types of problems, they are not resolved. They're still suffering, and for those of you who have vertigo or Meniere's, you know how horrible that is. So I just want to give you a very brief description how upper cervical chiropractic procedures can help people with vertigo and Meniere. So it goes something like this. The back part of your brain and the vestibular nuclei, which sits in the brainstem, and the joint surfaces of the neck and the inner ear all have neurological connections, if you will. So the inner ear has semicircular canals. There's fluid in the semicircular canals, and there's hairs in the semicircular canal, and as you move your head in certain orientations, the fluid changes with the gravity, affects the hair. It tells the back part of the brain what's going on in the inner ear, and then there's, if you will, a computation that takes place in the brain, and instantaneously your brain knows where you are in space. Well, there's an interplay between that network and the joints in the upper neck. And what they found in the top 3 joints, so that's C1, skull, C2, 3, and C3, 4, at those joint levels, there are actually nerve pathways that come from the joint surface into the spinal cord and affect the back part of the brain and the vestibular apparatus. So a lot of these vertigo cases, they go in, they get tested, they look in the inner ear, they run all these tests, and lo and behold, all the structure is just fine. And the reason that is it's not the structure. It's the information that's passing back and forth between the inner ear, the neck, and the brain, back part of the brain called the cerebellum. And so most of these cases, what's happening is they've had a prior neck injury. One of the joints in the neck, usually C1 in the skull, sometimes C2, 3, has dislodged, the ligaments torn, the vertebrae become locked, and when that happens, the muscles in the neck lock down. They become tight. Most of these people feel like their head is heavier than it should be. They get cognitive problems. And so when the vertebra is locked out of position, all of a sudden the joint's not moving the way that it should be. C1, superior facet, so the joint at C1 has more nerve endings on its joint times 10 than any other joint in the body. And so when that atlas gets locked, that nerve endings on the surface of the joint start to function aberrantly because they're getting more pressure than they should, and that sends aberrant signals back into the central nervous system. It can affect all these different pathways, one of which being vertigo. So this is the mechanism of people that come in with vertigo. We basically take very precise x-rays. We find exactly how their spine has misaligned at the joint level. We find out how they're off. We find out how the angles of their joint are built, and we introduce a very precise force to take that vertebra back, to get it back under control, back into motion, so the soft tissue, the ligaments, the soft tissue, the muscles that have been out of bounds, the nerve endings on the surface of the joints can go through a repair process, and you can function more normally. So I would implore you, if you have any vestibular type problems, whether that be vestibular migraines, tinnitus, vertigo, dizziness, Meniere's disease, any of this family of problems, it would behoove you to consult with an upper cervical doctor to see if your upper neck is involved with that. All right, thank you.